Now to a story we've been tracking since May of this year. We told you about the one patient who died and 5 others infected by mold at Seattle Children's. And new tonight, we're learning more about the mold detected in those operating rooms.
Health Department documents provide some details on the timeline of events. KingFab's Natalie Swaby joins us in studio now with what she's learned. Natalie?
Well, Greg and Mark, with this mold, Aspergillus, the risk of developing an infection for patients is very low, according to the hospital. But 3 patients did in 2018, and 3 more patients were infected this year. We're told they were at high risk because of the types of procedures they had. The mold led to operating rooms closed, surgeries postponed, and the state health department investigated. Tonight, thanks to a public records request, we know more about that investigation. November 20th, 2017. A whistleblower contacts Washington State Department of Health saying they're a Seattle Children's employee wanting to remain anonymous as they report an unsafe facility condition. In an email, the whistleblower writes, a company was hired to fix leaks in the hospital's Forest building and claims there's a potential that mold is in the HVAC system. The Department of Health's Office of Investigations and Inspections found no deficiencies, saying staff did identify a water leak but corrected it, and the allegation that there was an ongoing issue with mold was not substantiated. Fast forward to August 2018. Department of Health conducts an investigation after Seattle Children self-reports incidents involving 2 post-surgical patients that cultured positive for aspergillosis, an infection caused by mold. Operating rooms were closed and an air quality consultant was brought in. After a public health advisor conducted interviews and toured the facility, the conclusion on this complaint found no deficient practices and no violations. But 9 months later, Seattle Children self-reports again more concerns related to Aspergillus. May 24, 2019, Seattle Children's announced it was closing its operating rooms. May 30th, Department of Health conducted an on-site investigation and based on that visit, found the hospital's governing body failed to ensure that all patients had access to safe and appropriate care. Seattle Children's received a list of deficiencies and the hospital responded with a plan of correction. The chief medical officer, Dr. Mark Del Beccaro, said this on July 2nd.
As we are watching the efforts that we've done to remediate the issues and following the air testing, we will not open until we feel it's safe to do so.
Days later, the hospital's plan to reopen with new safeguards in place to protect patients was approved. Seattle Children's says daily air tests have confirmed the operating rooms are safe and they remain open. In mid-July, experts from health departments and the CDC toured the facility. Seattle Children's says the agency's feedback was that the hospital has taken the appropriate actions to reduce the risk of future Aspergillus infections.
Okay, a lot of documents, but you did a great job breaking them down. Thank you.
Thank you.
Yeah.